Have you ever wondered about the capacity of our laboratories in the Eastern Caribbean with respect to COVID-19 testing? Welcome to A Matter of Fact, a production of the Pan American Health Organization for Barbados and the Eastern Caribbean countries. I'm Nicola Barito. A Matter of Fact is designed to inform and educate you about the SARS-CoV-2 virus, which causes COVID-19, while taking an in-depth look at the benefits of vaccination. My guest is Dr. Lionel Gresh, Virologist and Laboratory Specialist at the Pan American Health Organization and the World Health Organization. Dr. Gresh, welcome back. Thank you once again for giving us your time. Let's dive right into it. In a COVID-19 environment, can you tell us the role and function of our laboratories in the Eastern Caribbean countries?
Of course, the main role of laboratories is to conduct testing. And testing is extremely important for many infectious diseases, and in particular for COVID-19, as it can help guide clinical management and the implementation of public health measures. Testing also allows us to know when and where the COVID virus is circulating, and it's part of what we call a surveillance system. But the role of laboratories has really to be seen in a wider context, and from the collection of specimens to the reporting of the results of tests to individuals, to healthcare providers, to surveillance teams.
Dr. Gresh, in terms of overall capacity in the ECC, what is our rating?
As I've mentioned before, the recommended tests, PCR and antigen tests, are available locally in all Eastern Caribbean countries. What is really important to understand is that at the beginning of the pandemic, very few countries had actually the capacity to perform PCR. So it took a tremendous effort led by ministries of health in the region with the support of international organizations such as PAHO WHO to set up that testing capacity. In some countries, we started from scratch and we had to design laboratories, select and procure equipment, train personnel. Today, all countries can perform PCR. Some countries even have several laboratories doing so. However, our capacity is strained in many countries by the recent increase in cases that we've been observing over the past weeks and months. So in this context, we need to continue working on expanding our PCR capacity, but maybe more importantly, we need to further expand the use of antigen tests, because these really have the potential to curb the spread of the virus by allowing for the rapid identification of cases, in particular those who are the most infectious, and then for a rapid implementation of public health measures, such as the isolation of cases and the tracing of their contacts.
Last but not least, Dr. Gresh, let's talk about the human resource, the lab technicians, the lab teams. What about their capacity?
I have to say I'm amazed at what laboratory teams in the Eastern Caribbean countries have accomplished over the past 18 months. And here I'd like to point that is not only the technical team, not only those laboratory technicians and technologists, but really all of those who are involved in the work of laboratories and in their daily operations. As I mentioned, many laboratories in the regions did not have that capacity to perform PCR 18 months ago. And 18 months ago, that was the only testing that was available. So we had some personnel that had theoretical training on PCR, but very few that had extensive hands-on experience. So it really took a clear individual and collective effort to set up that testing capacity and to set it up in such a short period of time. Today, we still depend on the dedication of these teams working countless hours to process in the shortest time possible hundreds and hundreds of samples. So when we think of these health workers and frontline workers we need to protect by making all possible efforts to slow the spread of COVID-19 virus, we think, of course, of nurses, we think, of course, of doctors, but we should also think about laboratory personnel. It's also important to mention that the contribution of laboratory teams outside the public health sector has been significant in many countries, as in the process of building capacity and expanding testing capacity, we receive support from universities, from forensic labs, from agriculture labs. So the work undertaken by all these laboratory teams during these past 18 months will also have lasting effects even after we control this pandemic, because the human and technical capacity that has been established and that has been strengthened in the region will be important in the future to tackle endemic diseases as well as those that might emerge in the coming years. So many thanks really to all the laboratory teams, to all my colleagues and friends in the Eastern Caribbean country labs for all their work. And to you all, thank you for listening. And remember that we can only control COVID-19 with your help. So choose to get vaccinated, wash your hands, keep your distance, wear your mask, and get tested if you have symptoms of COVID-19.
Thank you once again, Dr. Gresh. This has been A Matter of Fact, a production of the Pan American Health Organization for Barbados and the Eastern Caribbean countries. I'm Nicola Barito. Get vaccinated.